Fifth presenter today is Dr. Mike McDermott in the psychology department. He's going to be examining the link between psychological and physical health.
Okay, sorry we're having trouble with the mic. I think we're good to go now. So as Dr. Cross said, I'm going to be talking about some of my work examining the association between psychological health and physical health, so how these two are related or connected. On the one hand, we know that psychological health is directly related to physical health. We also know that physical health is associated with psychological well-being and psychological health. So these two interact in this bidirectional reciprocal relationship. So some of the work that I've done in the last 10 years or so has really examined not necessarily psychological health, but psychological disorders. So things like post-traumatic stress disorder, borderline personality disorder, or anxiety and depression more generally are associated with the development of poor physical health problems. We also know that that bidirectional relation exists also, that if somebody experiences a health problem, like chronic pain or migraine, that those individuals are at increased risk for psychological health problems like anxiety and depression. And so we see this bidirectional relation between the two. I'm looking forward to the slide over. Okay. In addition to my work on whether these disorders are associated with one another, I'm also interested in underlying factors that help us understand why and how they're associated with one another. So things like behavioral, emotional, and physiological factors that might help better explain how, for instance, psychological disorders are associated with physical disorders. One area of research that I'm interested in is this idea of emotion regulation. And so emotion regulation is not emotional suppression. Instead, emotion regulation is an awareness, a clarity of the emotions that you're experiencing, and then a willingness to engage in things that might be a little bit difficult, even though they're valued or meaningful to you. And so we know that emotion regulation is associated with all sorts of psychological health and psychological disorders. There's also some emerging research that emotion regulation might be related to physical health as well. So this is one of those that we might be able to target or identify as a transdiagnostic factor that might underlie how and why we see psychological and physical health related. And in fact, in a couple of studies that I recently finished up, we found that psychological disorders like borderline personality disorder, post-traumatic stress disorder, those increased likelihood for the development of physical health problems. So having one of these disorders meant that you're at more likelihood, and a greater likelihood to have a physical health problem, but that it influenced it through changes in emotion regulation. So those individuals who had a psychological disorder then had difficulty regulating emotions because of that disorder, and it was that difficulty that affected physical health. More recently, I'm also interested in that other relation. So how can physical health affect psychological health through changes in emotion regulation or through emotion dysregulation? Within that, I'm interested in the notion of exercise, and so how exercise can affect psychological health. On the one hand, we know exercise plays a role in physical health. We're also finding, and this is in the last 20 years or so, we're finding that exercise can be beneficial for psychological health. So you take somebody who's depressed and you ask them to exercise, you start an intervention to have them exercise, and those individuals get better. But do they get better because there's something about exercise per se, or do they get better because of what we call behavioral activation? They're doing things that are enjoyable and meaningful. So is it something about the exercise, or is it that they're just getting out and they could be doing anything like bowling with friends or something like that? To examine this, there's some emerging research that shows that potentially exercise affects emotion regulation. So that when you exercise, you might be better able to regulate those distressing emotions. So a current study that I'm working on right now with some folks in the kinesiology department, we're examining the role of exercise on emotion regulation. So what we do is we have them come in, they either exercise or they engage in a rest condition, and then we ask them to do something really distressing and really difficult and see how they perform. And so if, for instance, we can find, and the data's not in yet, but if we can find that those who engage in exercise have an increased ability to experience negative emotional states and then persist in a goal-directed or valued behavior, then that's evidence that potentially what we're seeing is that exercise might affect psychological health and psychological well-being by changes in emotion regulation. You might be better able to manage those difficult emotions when they come up and when they present themselves. So just to tie in my general research and where we're looking to go is to identify those factors that help us better understand how and why psychological health or psychological disorders might be affecting physical health, so that relationship there. And I appreciate letting me talk. Thank you.